everyone. It's Saturday, April 25th, 2020, and this is the Homeless Perspective Weekly Update coming to you from Anaheim, California. My name is Tim Houch, and I'm your formerly homeless but very grateful host of today's program. Thank you for watching. This program is an extension of the Homeless Perspective News blog. Our purpose is to keep you informed about the ongoing homeless crisis that continues to impact communities in Orange County and other communities across the state. It's our intention to promote discussion about solutions to end homelessness. Our belief is that homelessness ends when a homeless person transitions from the streets into a permanent, healthy, safe, and secure place to call home. Now, we value your opinions, and we encourage your participation regardless of your opinion. However, please remember, we are looking for solutions. No is not a solution. If not in your backyard, then please tell us where. Would you like to be a guest on a future broadcast of the Homeless Perspective Weekly Update? Do you have an announcement or an event that you would like to share with our viewers? Do you have a videotape public service announcement from your community or nonprofit organization? If it is 90 seconds or less, we'll be happy to share it with our viewers. We appreciate your comments, suggestions, and your requests. Please visit our Facebook page, leave a message, and be sure to like us at www.facebook.com/homelessbrother. Homeless Perspective Weekly Update will be back after this message.
Out in the West Texas town.
Each year, we gather on the winter solstice to honor the lives of those members of our community that died without permanent, healthy, safe, and secure places to call home.
Mark Plunkett, Pamela Garcia, William Montague, Julian Bernal, David Toohey, Jessica Fleming.
So when we come together to say these people are noble, they are real human beings that deserve to be honored for their courage, their determination, the ability to survive.
Welcome back to the Homeless Perspective Weekly Update. Here's what's been happening. A judge won't block the County of Orange from using the Laguna Hills Inn to house people who are homeless and have or are at high risk of contracting the coronavirus and need a place to be isolated. Orange County Superior Court Judge Thomas Delaney on Monday, April 20th, tentatively ruled against a request for a temporary restraining order from the city of Laguna Hills and owners of 4 properties near the 76-room hotel. The city and other property owners located in Plaza Point Center, along with the hotel, argued the conversion of the Laguna Hills Inn violates the rules for uses in the plaza previously set by the property owners. The county on April 7th agreed to lease the Laguna Hills Inn for a minimum of 90 days, paying the hotel's owner $250,000 a month in rent. But on Thursday, April 16th, Delaney temporarily blocked the county from using the hotel, saying he wanted more information from the county on its ability to utilize the property. In his tentative ruling on Monday, Delaney said California's declaration of emergency gives the county, as an agent for the state, the ability to commandeer a private property to address a public health crisis. Delaney noted that under Governor Gavin Newsom's Project Roomkey, the state and its counties are trying to move tens of thousands of homeless people into facilities such as hotel rooms during the coronavirus pandemic. The county has contracted with hotels in other cities, including Stanton, Orange, and Huntington Beach, for this purpose. The county is acting consistent with the governor's orders in the context of this state of emergency, Delaney said in his tentative ruling. On Saturday, April 18th, Governor Gavin Newsom held a press conference at a Motel 6 location in Santa Clara County, where he mentioned that some cities were blocking efforts to place homeless persons in motels, but fell short of mentioning the names of those cities.
We cannot do this alone as a state. We're sort of building the plane, but someone else has to fly it. It's the counties that really lead this effort. and it's the cities that need to support this effort. I mentioned those counties that have excelled. There are an equivalent number of cities, unfortunately, that have not, where cities are blocking these efforts at a time of crisis. The most vulnerable Californians on our streets, seniors that are just desperate for a key, a lock, a place of their own, the dignity that comes with that, their lives on the line. I just want to encourage those cities that are blocking efforts like this to consider themselves in the context of others, to consider their action in the context of their community, to consider their actions in the context and annals of history. They'll judge themselves, not just be judged by others.
In his press conference, Governor Newsom spoke about Project Roomkey as a subset initiative to place homeless persons in motels and provide wraparound services for them.
We announced a series of initiatives a number of months ago on homelessness, but one of the subset initiatives we announced a few weeks back was Project Roomkey. In partnership with FEMA, Project Roomkey would identify 15,000 hotel rooms throughout the state of California. Those hotel rooms would be supported not only through food programs and delivery services, but with basic social services to meet the needs of those that we would provide accommodations for.
The governor also announced that the Motel 6 corporate chain of motels would make 47 of its motels in 19 counties available for Project Roomkey.
This effort, though, as well, is made even more significant by the announcement with Motel 6 in their corporate headquarters here in the state of California. They are setting aside, as part of a master agreement template, some 47 Motel 6s like this in 19 counties in the state of California, some 5,025 additional rooms. That's on top of the roughly 11,000 that are part of Project Roomkey. So now we have the capacity that exceeds our original goal.
Of the 47 motels mentioned by the governor, only 2 of those locations were within Orange County, according to a source from the County of Orange. The 2 locations are not considered as viable locations at this time, however. The county is negotiating with other motel hotels in the county. Project Roomkey has been a subject of discussion by homeless advocates who say that while the program meets the needs of the subset of the homeless population that are either elderly or suffer underlying medical conditions by providing them with motel rooms so that they can practice social distancing and shelter in place, the program, however, does not meet the needs of a majority of unsheltered homeless persons living on the streets who are otherwise healthy and young. It has now been over 1 month since Governor Newsom gave the order for Californians to stay at home, but California's unsheltered homeless populations have been left on their own to defend themselves from COVID-19, and it does not appear that there are any plans to provide shelter for them. Reports are saying that cases of COVID-19 are on the rise among the street homeless, while at the same time, people that live in homes are protesting orders for them to stay at home and demanding that the orders be lifted by officials. Advocates are concerned that there could be many street homeless that are positive for COVID-19, but are symptomatic, might spread the virus to the first groups of people who may soon be venturing outdoors and near the same places where street homeless persons hang out. Earlier this week, it was reported that an outbreak of COVID-19 was discovered at the Union Rescue Mission on Skid Row in L.A. 178 persons were tested and 43 were found to be positive for the virus. But the most troubling part about this outbreak was that of those that tested positive, 37% showed symptoms of COVID-19, but the remaining 63%, or 26 persons, tested positive but showed no signs of the sickness at all. Here's the story.
The invisible threat has become another reality. COVID-19 is spreading into shelters. Union Rescue Mission CEO Reverend Andy Bales has been fighting for the community's most vulnerable populations for over 30 years. But the announcement by county officials on Tuesday that 43 of the over 200 people tested earlier this week at Union Rescue Mission were positive for COVID-19 is a huge blow to the shelter.
We've never faced anything like this. This COVID-19 is a ferocious, fierce, mysterious, unseen monster.
Complicating matters is the fact that dozens of those who tested positive were asymptomatic. LA County Health Director Dr. Barbara Ferrer said on Tuesday that the county is hoping to increase institutional testing, with 8 shelters now being investigated.
So it just makes sense now that we're able to do more testing, both of symptomatic people and asymptomatic people who are very high risk and live in these congregate living situations.
The large outbreak at Union Rescue Mission, whose first confirmed case was on March 28th, has been an exception mainly due to the fact that everyone there was tested. 413 residents remain at the shelter, but that number has been decompressed from 1,000. And in the last 2 weeks, they've moved 184 people to hotels and motels.
We have done everything you can imagine doing to combat this. And we started preparing when this was in China, and yet it has chosen to invade in a fierce way.
And while the county doesn't have the capability of testing everyone in shelters yet, pop-up sites have been set up for those experiencing homelessness. As of Tuesday evening, 186 tests had been performed. Union Rescue Mission now has 56 confirmed cases between residents and staff, including one staff member who died from the virus. It's a battle they're working around the clock to fight.
It's been the biggest challenge, like I said, of our lives, but we can do it. With help, we can do it.
The invisible threat of visible reality.
The Union Rescue Mission outbreak confirms the fears of homeless advocates in Orange County who say that the county must begin testing homeless persons in the shelters and those living on the streets immediately in order to divert a disastrous outbreak that could spread through the homeless community and infect other members of the general public as well. As recently as this past Monday, there were no plans to test any homeless persons for COVID-19, according to officials from the county. A Homeless Perspective news article on Wednesday, April 22nd, called the county's current plan without testing flawed and cited the outbreak at the Union Rescue Mission as an example of why testing for COVID-19 among Orange County's homeless is absolutely necessary. To quote the Homeless Perspective article, it says, using the current model, the county is setting the shelters up for failure and maybe turning homeless shelters into incubators for COVID-19. If you look back at the Union Rescue Mission on Skid Row, they tested 178 people, found 43 to be positive for COVID-19. Out of the 43, 37% or 16 of those were displaying symptoms, but an incredible 67% or 26 persons showed no symptoms whatsoever. If the same similar situation were to take place at an Orange County homeless shelter under the current policy without testing, only 16 people that were displaying signs of being sick would be placed in quarantine at the motel or hotel. But the 26 people that were positive for the virus would have gone untested and undetected in Orange County, and those individuals would be made to remain in the shelter to infect others, including persons coming in from the street that are elderly or with underlying medical conditions. Jason Austin, the Orange County Director of Care Coordination, told a Homeless Perspective reporter on Friday that the county was now discussing the idea of testing some persons experiencing homelessness in the county, but fell short of providing any details. Coming up next will be our weekly message of encouragement for those experiencing homelessness and the people in our community that want to help them. But first, these words.
Sometimes I sleep under the bridges, sometimes in cardboard boxes. Yeah. They're the best, man.
I used to be in a shelter, but I haven't been in one in a while because I don't drink and I don't do drugs anymore. And that's where most of the kind of crowd is, in a shelter.
I can't get a job here or here or here. I can't have any apartments because they won't accept felons. And I even went through an agency that took felons, and they'll give a pedophile an apartment before they will me because I had a drug charge. I wasn't even dealing drugs, I had possession.
I mean, I've been to a lot of interviews, and they look me up and down and just say, we'll call you, leave a number. How am I supposed to leave a number if I ain't got a phone?
And just the hard part was just becoming part of society again. It's like they didn't want me. They didn't want me to be part of their society anymore.
I mean, it's emotional. I'm trying to get my life together. Don't give you any reason to call me a bum. No matter what people say to me, I remember I'm a human first.
Hey baby, ¿qué pasó? Thought I was your only vato. Hey baby, ¿qué pasó? Please don't leave me decimoso.
All right, welcome back to the Homeless Perspective Weekly Update. And now this message of encouragement for persons experiencing homelessness.
Don't you know that I love you? Please don't leave me decimoso.
Hi folks, it's been brought to my attention that many of my homeless friends and neighbors do not have medical coverage, and that many others that are covered by Medi-Cal are not using the coverage to their advantage. Medical experts are beginning to determine that chronic homelessness is in itself a disabling condition, which means that if you have been homeless for 1 year or more, you may qualify for supplemental income benefits and or disability benefits from Social Security. Now, in order to do this, you must first be enrolled in Medi-Cal. You can go to your local social services office, or you can apply online at www.mybenefitscalwin.org. At the website, you can also apply for CalFresh, formerly known as food stamps, and find other programs that you may be eligible for. Once you have Medi-Cal, you need to establish a primary care physician and go every month so you can begin documenting any disability that you may have. My suggestion is to choose a healthcare provider that has both an emergency room and a walk-in clinic so that all of your medical records are all kept under one roof. It may take a while for you to begin receiving your benefits, but keep all of your appointments. You may be entitled to receive back pay from the time that you were first diagnosed. One of my patients recently received a check for $46,000 in back pay. Start today by getting enrolled into Medi-Cal and begin seeing a primary care doctor once a month. Begin documenting any condition or injury that may be permanent or disabling. You will get an opportunity for permanent housing eventually, but I want to see that you survive until that day. And when that day comes, I want to see you prosper. Follow these steps that I have told you today and begin working on a future that is prosperous for you. Survive and prosper, my homeless friends and neighbors. Okay, that brings us to the fun part of our program today, where we play a selection from our list of top 100 homeless songs of all time. That's right, these songs, these are songs that relate to homelessness, and many of them are very good. You may have heard some of the songs before, or perhaps you might recognize the artists. But the chances are good that you might not even know the song was about homelessness. Today's selection comes from local artists and was recorded here in Orange County in 2018. The inspiration for this song came from the homeless encampment that once existed along the Santa Ana River Trail near Anaheim Stadium. During its day, the encampment was considered the largest encampment in the United States, with some estimates saying that more than 1,300 persons were living along a 2-mile stretch of the river trail until they were pushed by the County of Orange into the streets of Anaheim and other surrounding cities. Also, maybe some of you will recognize the photographic images in this video as the photographic artwork of local artist and homeless advocate David Freeman. For your enjoyment, I present Matt Johnson and T with their musical masterpiece, There It Went. Check it out.
All I've got is what you see, a cardboard bed that sometimes gives me sleep. beside the fire. I'm shivering wet along this lonely river's edge. Thought I could handle life, but there it went. Look inside, see my soul. It's there somewhere behind my wrinkled coat. Unwashed hair, a beard unkempt, sleepless nights inside my tent. Thought I could handle life, but there it went. A few bad months, that's all it took to leave me here. Alone, foundation shook. The life I knew was swept and fled into this concrete riverbed. Thought I could handle life, but there it went. Save this precious land. I've never dreamed I'd wind up dead without a home where I can lay my head. Thought I could handle life, but there it went. As you can see, so many others living just like me. Cold and hungry, we're barely fed. The tides have turned, our sun has set. Thought I could handle life, but there it went. Thought I could handle life.
Well, I hope you enjoyed the program, and thanks for watching. Please join us for the next Homeless Perspective Weekly Update. So goodbye for now, until next time, and please be safe.
The low rider is a little higher. Drives a little slower. Low rider is a real goer.
It's my perspective, damn it.